Good afternoon, everyone, and welcome to our webinar, Successful Collaboration Between APS and Victim Services. This webinar is being brought to you today by the U.S. Department of Justice, the Elder Justice Initiative, and the Office for Victims of Crime Training and Technical Assistance Center. My name is Lori McGee. I will be covering some technical overview for you, which is if you have any technical issues with your audio, what you're seeing on your screen, closed captioning, whatnot, please feel free to send us a message in the chat box. For those technical difficulties, contact Kayla through the chat. And if you cannot access the chat or having trouble with that for some reason, you can also email her at khough@ovcttac.org. As with all technology, we may at some point experience a momentary lapse in the webinar session. In the event of such a problem like that, please just be patient, remain with us, and the webinar should resume shortly. So we do want to take a moment here and see that everyone is connected, give you a chance to chat in if you're not. I see lots of folks saying hello from your various parts of the country, so we welcome you all. Glad you could join us here today. If you have questions for our presenters throughout the webinar, please feel free to also use the chat box for that, and we'll have some time at the end of the webinar to address those questions as we're able to. And I also want to note that today's session is being recorded. That will be made available on the OVCTTAC and the Elder Justice websites following the webinar. It usually takes about a week or two to get those up. And along with that, the EJI has also put together a series of webinars. Hopefully you've joined us on some, but if this is your first time with us, we welcome you. We do record all of these webinars and make those available for various audiences, again, on those training websites. So at this time, I'm going to turn things over to Maria Schumar with the Elder Justice Initiative to introduce herself and our presenters and get us going today. Maria.
Hi, thank you, Lori. And thanks to everyone who's joining us today. It looks from the list I'm looking at here, people from all over the country, so that's really exciting. And yeah, I work at the Elder Justice Initiative. It's part of the Department of Justice, and we are committed to combating elder abuse by providing training such as this webinar today and providing resources such as our elderjustice.gov website, where we have a wealth of information to assist you in helping the older adult population. And as you know, two of the big networks that assist older adult victims are Adult Protective Services and Victim Services. It's a pleasure to introduce to you today two experts in the field of elder abuse prevention, Keeley Frank and Trudy Gregorie. Trudy Gregorie, let's get her picture up there, is the Executive Director of the National Adult Protective Services Association, also called NAPSA. She has 40 years of experience in public safety, crime victim services, and justice systems at the local, state, and national level. From a prosecutor's office to a governor's office at the State Crime Victim Ombudsman to the National Center for Victims of Crime and Justice Solutions, a national nonprofit, she has provided training, technical assistance, and public policy work on victim and justice issues. Throughout her career, she has maintained a special emphasis on working with older victims and abused vulnerable persons. She has been involved in the development of numerous training curricula and resources and is certified by numerous training centers. She is co-author of the seminal Polyvictimization and Later Life e-learning curriculum through the OVCTTAC, and she serves on the board of the National Association of Triads. In 1999, Trudy was awarded the National Crime Victim Services Award by President Clinton, and in 2012, she was awarded a Lifetime Achievement Award by the National Association of Triads. In 2014, she received the Rosalie S. Wolfe Memorial Elder Abuse Award presented by the Institute on Violence, Abuse, and Trauma of Alliant International University. And our other presenter, Keeley Frank, LGSW, is the program specialist for the National Center for Victims of Crime Victim Connect Senior Services Program. In this capacity, she provides resources and referrals for older victims on the Victim Connect helpline. She also develops training materials and presentations on elder justice and aging for providers to better serve older victims. In addition, Keeley has worked as a victim advocate for older victims of crime in Philadelphia, where she specialized in domestic violence and sexual assault. She was a member of the Domestic Violence Law Enforcement Committee, Coordinating Council on Domestic Violence, and assisted in the development of Elder Justice Resource Center in the 1st Judicial District in Pennsylvania. So now I'm going to turn it over to Keeley and Trudy. Take it away.
Thanks, Maria. Hi, everyone. Before we get started, we want to do our first polling question just to get a better idea of who all is viewing. Okay, cool. So it looks like a lot of you are in victim services, but there's a pretty good spread. So like Maria said, I work with the National Center for Victims of Crime, and it was founded in 1985 by the family of Sonny von Bulow, who felt that the experiences of victims really needed to be redefined within the criminal justice system. The National Center is the nation's leading resource and advocacy organization for victims of all types of crime and for the people who serve them.
And my name is Trudy Gregorie. As you heard, I've been in victim services for a very long time. And services for older victims have always been a major concern for me, both as a systems-based advocate and as a nonprofit-based advocate. I only recently joined NAPSA as the executive director because of that interest and concern, but I also admit to somewhat of an enlightened self-interest as an aging victim service provider, because I'll soon turn 65, and knowing the statistics, I want the best services possible in place for all elder abuse victims and potential victims, including myself. So I've joined NAPSA, which was formed in 1989 as a National Association for Adult Protective Services Professionals. So that means in 2019, we will be 30 years old. We have about 900 members from all 50 states, D.C., and the U.S. territories. Our purpose is to strengthen adult protective services through education and training. We have a certification program for APS providers, through research, and in particular, and looking at best practices in responding to elder abuse and abuse of those 18 years of age and older with disabilities, and also through advocacy at the local level, the state level, and the national level. But I want to tell you, I want to tell you a little bit about APS as well. Some of you may be very familiar with APS, but some of you may not. There are aspects of adult protective services that vary from jurisdiction to jurisdiction. For example, they may be housed in different departments or different agencies in your community and state. 64% of APS agencies are state administered. 15% are county administered, and 21% are administered various other ways, including within nonprofit organizations on a contract basis. APS serves as a victim-focused social services response. So we're not a criminal justice agency. We are social services, but we're part of the elder justice, but just not from a criminal justice perspective. In all states, Adult Protective Services is charged with receiving and responding to reports of maltreatment and abuse, and to attempt to remedy or reduce that abuse for the victim. APS frequently serves as the very first responder to instances of elder abuse and work very closely with law enforcement, with criminal justice, prosecutors and the courts, area agencies on aging, and in fact APS in some jurisdictions are housed in the AAA, or the area agency on aging, and also works very closely with other aging services within communities. Historically, there's been no federal home for adult protective services, no dedicated federal funding stream, no national legislation that governs the operation of APS programs. So as a result, we get this variation among states and communities with differences sometimes in policies and in practices. State legislation actually governs APS programs, including how abuse and neglect are defined, what the eligibility criteria is for services, and program policies and regulations. So there is no common definition of who is served in each state or what services they receive. So you need to check your state laws for which forms of abuse constitute elder abuse in your state. But I can tell you where APS investigates instances of elder abuse. In 100% of states and jurisdictions, APS responds to abuse that happens within the community, where the victim resides, in their home or in the home of their caregiver. In 50% of states and APS programs, APS also investigates abuse that occurs within facilities where the older victim resides. When we look at the eligibility for APS response, and remember I said it can vary from state to state. In 42 states, all adults with disabilities age 18 and older, if they are abused, APS can respond. In some states, APS response is limited for older victims to age 60 and over, and in some states that may be 65 and older, or they must be age 60 plus and meet the state definition of vulnerable. So you really have to check your state setup for APS, for where it's housed, eligibility, where APS investigates, and what constitutes abuse. What we really want to talk about today is looking at that multidisciplinary approach for APS and victim services to work together in response. For APS staff, we are faced with ever-increasing caseloads, as well as very complex cases beginning to come on caseloads of APS workers. So staff work really hard to locate and access needed services for their clients within the community. And victim services where they exist are an absolute resource that APS needs to connect with. Multidisciplinary cooperation is at the very heart of APS work, whether it's through a formal multidisciplinary team or informally across community agencies and colleagues. So APS works very closely with law enforcement, community-based aging services, and hopefully more and more with victim services.
And one thing that some people might not realize is that a lot of areas in the United States still don't have specific charges listed as elder abuse, so you might not actually be able to be charged with specifically elder abuse.
I think the real point Keeley's trying to make is that you need to look for where different forms of elder abuse might fit into the what are identified as criminal acts within your jurisdiction, whether it's homicide, assault and battery, domestic violence, or theft and fraud. And with the growing opioid crisis within the country, it might even come in under a drug charge. So making sure that when you look at whether it's a law enforcement report coming in or however cases come into your victim services program, to make sure you're looking for the age of the victim so that you can identify whether it might be a case of elder abuse.
I'm going to shoot a question to you, if that's okay,
Sure.
Trudy, while we're waiting for Keeley. If someone comes across a person, say, age 62, who is not really vulnerable, like, say, cognitively or physically, but is being abused, what should they do? Should they make a report, or does it depend on the jurisdiction? What would you recommend there?
Well, it depends on the jurisdiction as to whether APS can respond. If they are one of those states where the age and the meeting the definition of vulnerable is the criteria, but I think it's better for a report to always be made to Adult Protective Services, and then APS can refer that individual. If they don't meet the criteria for response, they can refer that individual or whoever is reporting on that individual's behalf to services within the community that can respond to whatever that need is, whether it's law enforcement, victim services, aging services. So I would say always make a report to APS.
Yeah, good idea. Thank you.
So thank you, Trudy and Maria. While some states may not have specific elder abuse statutes or charges that someone could be charged with in the criminal justice system, there are other ways that someone could still be held accountable. So, for instance, if you make a report to APS, but then like saying that you haven't seen your neighbor in a while, or maybe you heard some screaming or something coming from your neighbor's house, and then you also call the police. From my perspective as a victim advocate, the case that I might end up seeing in court could be something like terroristic threats or a simple assault, neglect of a care-dependent person, something like that, in a community where elder abuse is not actually a charge that someone could be charged with. If you think about it the same way as that oftentimes someone would not actually be charged with domestic violence, they would be charged with like harassment, assault, a strangulation charge, all those other things, and it's just that people, states are trying to catch up to the system and realizing that elder abuse is something that needs to be on the books, but it just isn't yet for a lot of places. So that's why we're trying to see that, we're trying to show that a lot of crimes that you might see in APS are the same types of things that I would see in victim services. They're just maybe listed differently on the criminal docket, including things like theft and burglary and all that kind of stuff. I know as a victim advocate, there are several things that I'm most likely going to be asked to assist with, and so the primary one that I think most people do some form of is a needs assessment. Depending on what capacity you work in, this can be a very formalized process, or it can be kind of an informal question and answer to determine what steps need to be taken next to ease someone's potential suffering after a crime. As part of the outcome of that needs assessment, I may realize that the person hasn't been informed of emergency financial assistance that's available to most victims of crime, and that's called crime victim compensation. So in every state, there is a designated crime victim compensation program, but each state has their own requirements for applying for that program, so you would have to look into your state's specific programs. So one thing that I've been able to do as an advocate and that other advocates are able to do for elder abuse victims is to advocate on their behalf to their crime victim compensation program to say, you know, maybe there are certain reasons why this potential victim didn't meet your requirements. Like some of them have a 2-year window. So from the time that you learn of crime victims compensation or from the time that the crime happened, you have like a 2-year window to then apply for it. And some people, you know, based on their circumstances, if the abuser is someone that they know or someone that they love, there are plenty of reasons then why they wouldn't apply for crime victims compensation. Or if someone never told them about it, that kind of pushes that window forward. And as an advocate, you can then speak to crime victims comp and say, you know what, I'm working with this older person and they were just informed of it, or here are the circumstances and this is why I think they should be eligible. And oftentimes the crime victims compensation people are very nice and they actually want people to use their services. Another thing that we've been able to do in the past and that victim advocates can help with is actually filling out those forms, because I'm sure well, okay, there are probably people that love filling out paperwork. I'm not one of them, and if you have just experienced a crime, especially a head injury, or if you have any kind of cognitive impairment, filling out tons of paperwork is not the best thing in the world, and especially the crime victim compensation forms, which require a lot of information, and oftentimes it's in very small print. So something that advocates can do is work directly with the older adult that has experienced a crime and either write, like fill in the blanks for the person if they have problems holding a pen, or if they aren't able to access or a computer or can't see it, or do it over the phone. You know, work that collaborative process in order to help them get those services. Also, depending on your agency, you may be able to do things like home safety checks and change locks after a break-in or after a potential protection order has been served. That's something that a lot of older adults can't afford to do on their own. You know, even like very basic things, a lot of older adults, because of poverty rates, just can't afford to replace locks or replace windows and things like that. And so as an advocate, if you're aware of the programs that may exist in your community, those are things that you can reach out to and say, hey, I'm working with this older person and this just happened. Can you please help out in this scenario? You can also, as an advocate, help with safety planning in general, and also recognizing that because elder abuse is most often perpetrated by someone that the older adult has a relationship with, that a lot of that safety planning can be not only physical safety planning, but also emotional safety planning if they're not ready to leave, can't leave, don't want to leave. And so what does that look like to keep them safe emotionally and mentally as well? And then talking through which social supports they have or don't have. And so are there groups in their community that they can join or that they were a part of before the crime happened and that they're scared to go back to? You know, there are different ways that you can kind of help out in situations that seem really overwhelming that you may not have thought of. Another way that crime victim advocates can really help out is navigating medical issues, and I don't think that's something that a lot of people think about. If you're an older adult, or really anyone in general, but especially an older adult, and you experience a crime, any medical issue you had prior to the commission of the crime is just going to be exacerbated and be so much worse, on top of any new medical issues you may have as a result of the crime. Add on to that, now that you're being required to go into a criminal courthouse, possibly for the very first time in your life, and navigating a system that is completely overwhelming, not only for the people that work in that system on a day-to-day basis, but also for the people that have never had the experience of being in that system, including things like not realizing that there may be different sides of the courtroom for victims to sit on or for perpetrators to sit on, or, you know, recognizing the lingo and realizing that everyone speaks in acronyms and they speak really fast, and if you're in a big city, they might have 60 cases that they need to get through in the next 2 hours, and there's only one prosecutor and they don't have time to talk to you. So if you are a victim advocate and you're working with an older adult that has vision or hearing problems or needs to go to the bathroom a lot, or is on blood pressure medicine, any of these things, what you can do is do your best to make sure that that experience is as comfortable as it could possibly be in an environment that was not created for older adults or really victims in general. But as an advocate, what I've been able to do is go up in front of the bar of the court and explain to them, like, I'm working with this older person. They have blood pressure medicine that they might need to leave to take, so if they're leaving the courtroom, they're not, abandoning their case or not being compliant. They might have a doctor's appointment. They might have a home health aide that comes at certain times of the day, so can we adjust when their case is going to be called? All these special things that if I wasn't an advocate with a badge, I wouldn't be able to do. So just things to keep in mind that you have the ability to do as an advocate, or that if you are thinking, man, I have this person that is going to be in the criminal justice system by themselves, you may have this other avenue of people that can help them out along the way. Also, mental health counseling. Some advocates run support groups or can help facilitate a victim of a crime creating their own support group. Some older adults really find meaning in what happened to them, and they want to speak to other survivors of different crimes and create their own. And also legal advocacy, so I can describe the criminal justice process, how it typically goes or how it might go, and let them know, like, this is what this person does, this is what this step is for. And one really simple thing that you can do if you work in the criminal justice system that I've found is create a one sheet of acronyms for the most common acronyms that you have in your courthouse and give that to the victims that you're working with. And this is a really simple way of keeping them involved in the entire process, because they might not be able to have time to actually sit down with the prosecutor and have them really walk through their entire case, just based on the nature of how many cases come through any courthouse. So that's one thing that you can do as an advocate to make sure that they are as up to speed as can possibly be. So that kind of takes me into what we're really pushing for here is, why would you want to collaborate, or like, why should you collaborate? And we think that it basically just makes sense to collaborate. If you think about it, like, other systems are already doing this, and it would be really weird if they didn't. So if you showed up at the hospital with some unknown illness, but the ER nurse never talked to the radiologist, who never talked to the oncologist, who never talked to the other ologists, no one would ever know what all the theories are of what's going on or how best to help you. And so what do you think your outcome would be, and how would your life be impacted by that? So then doesn't it make sense for every other system to help you, especially when trauma is involved, whether it's physical trauma or psychological trauma or both? So I just think it makes sense for APS and victim services, law enforcement, for everyone to work together. I don't know. I thought that made sense. So when you're working with older adults, I think if you've worked with them in the past, you've probably realized that no one is going to come to you with only one issue and one thing only. So that really, I think, is kind of the crux of where we as navigators of systems can really provide the most assistance. So just from the very nature of being an older adult, like, you don't live into your 60s, 70s, and beyond without being involved in some kind of system and having multiple layers of potential, problems and concerns and all of that. Not to say that, like, older adults have all the problems in the world. That's not what I'm saying. I'm saying that once you reach, older adulthood, you've been involved in lots of systems, whether that's through, like, education, Social Security, different career paths, whatever. And so lots of people have your information. And now, from the nature of our work, being in either APS or victim services, that's not fun things for a person to be involved in. Like, it's not a good thing when someone becomes involved with when I meet them, because I don't do a fun job. I work with people after they've been victimized. So what we need to really think about is how can we best work together to ease the suffering of the person that we're working with. And so we recognize that older adults have been given the short end of the stick within these systems because these systems were really not designed to accommodate them. There are fewer resources available in general for older adults, like across the spectrum of everything. But add on to that, I'm going to give you like really complicated case right now. But so what if the abuser is the caregiver, or what if the older adult is the caregiver of the abuser? What if the older adult has a history of sexual trauma, is also a veteran with a physical disability, was just given a diagnosis of dementia, is facing an eviction on top of identity theft? Like, what system was designed on its own to provide services to help out with every single aspect of that scenario? There's nothing. There was no system that was created that is perfect and could be like, I can help with all of that. So for any system to try to act on its own as a standalone kind of agency, it just doesn't make sense. So I think now we can go to our next polling question.
That looks good. I can see we've had victim services that have worked with APS, that have worked with both from their professional perspective. So this is looking good. Because what we really want to talk about now, given the fact that you are already engaging in some collaboration at your community level, is to go back to our slides, because we want to look at coordinated community response, which is at the crux of what needs to be in place in all communities in order to respond best and most effectively to the needs of older elder abuse victims. You can see all the different puzzle pieces fitting together there, whether it's the disabilities community, whether it is victim advocates. Remembering religious leaders can be very much a part and very important to the response to older victims. Whether it's adult protective services or health professionals, and remembering that it's not just the criminal justice system, but the civil legal system that might be a part of the needs that an older victim might have. Whether it's the contract that is over the services that they are receiving in a facility, whether it is often in a financial exploitation case, there may not just be criminal justice issues, but also civil justice issues, whether it's the long-term care ombudsman that might be involved if indeed the elder abuse victim is in a facility when that abuse occurs. So there's a range of different types of agencies and professionals that need to be in place to fit all the puzzle pieces together to ensure that that victim is receiving the wraparound services that are needed to most effectively respond to whatever their needs are. Keeley did a great job of describing all the wonderful types of victim services, and particularly how those victim services touch on the needs of older victims. And all of these different agencies, very often if you are an elder abuse victim, you don't know who to call. You may not realize or understand that's what is happening to you is abuse. You just know that how it's impacting you and how it's impacting the quality of your life. And to reach that point of trying to report it or to access services is a critical point for an older victim. So whether they call a prosecutor's office or it gets reported to the long-term care ombudsman, APS, law enforcement, whether they contact a service provider within their aging services network. Perhaps it's who is the person that's delivering their Meals on Wheels realizes that this could be a potential abuse situation, or they may hear something or see something on a public awareness announcement on television or on the radio, and they would respond to the phone call. So no matter where they call, that older victim should be able to access all of the services that they need. And how we describe that is a no wrong doors approach to victim services and response to what's happening to them as an elder abuse victim. It might be that it comes to light through their informal networks or existing relationships that they have. For instance, that Meals on Wheels delivery person, or their doctor, or an EMS person who might respond to their house if they have some type of a health problem, whether it's through APS or law enforcement, or through some type of community services or advocacy. No matter which one of those doors that open, it brings about responses from all necessary services, and again builds those wraparound kind of services that are so important for the older victims in our community, because none of us in our agency can provide everything that victims need. So that collaborative response is so important. It might be that we're collaborating on information and referral services. For instance, if the report is made to APS, but APS can't respond because the case does not fit criteria in that jurisdiction for APS, APS will know who they can refer that reporter to access services. Or it might be implementation of victims' rights. Perhaps that older victim has not received notice of compensation, and their medical bills are piling up, what's not paid by Medicare, or what they aren't able to access. Perhaps what's needed is training and technical assistance between our different agencies. Victim services in your area may not understand how APS works. APS very often may not understand what victim services are available. So cross-training, setting up times to really communicate, perhaps inviting an APS provider in your community to come to a brown bag lunch for your employees or your staff, and vice versa. Whatever can help us come to a better understanding of what our agency's role is and what we do for older victims. It might be public policy initiatives that we collaborate on to move ahead the response to elder abuse victims in our community. Making sure when it's National Crime Victim Rights Week that you're inviting APS to be a part of what you're planning. Or when APS is planning World Elder Abuse Awareness Day or Older Americans Month, that they make sure victim services are a part of what they're planning for those special events. Certainly, sharing and collaborating on research initiatives within our state, at the national level, wherever data collection might be happening, so that we can really begin to understand the issue of elder abuse. We know it's one of the most underreported crimes in the United States, and we need to get a better grasp of what the actual incidence rates are, what kind of response is happening, and how that's impacting the lives and the needs of older victims. So collaborating together on those initiatives is important. Increased funding and awareness. VOCA just recently really began to expand the funding of services for older victims, and the latest VOCA regulations opened up a lot of new ways that APS and victim services can work together to better meet needs. So perhaps the next round, yes.
Could you explain VOCA just briefly? Just a quick.
Ed, thank you so much. See, that's when we start talking in those acronyms and not explaining them. That is the Victim of Crime Act funding, which came out under the Victim of Crimes Act, which places fees, fines, and assessments on federal offenders in federal courts, and that money funds the Victim of Crime Act Fund, which is given and provided to the states based per capita. However many people are in your state, you receive a certain amount of money that comes in through your state VOCA administrator, and applications can be made for grant funding to fund direct services, and there's direct services to victims of crime, including older victims. And also part of that VOCA fund funds projects at the national level that responds to victims of crime. Part of the VOCA money goes to victim compensation. Some states augment that through fees, fines, and assessments in their own courts. So it's that funding for victim services, but it has to be for direct services. So it's really important to know where your VOCA administrator is housed in your state, what the funding cycle is, and really if you are needing to enhance your services to older victims, working together, perhaps, APS and victim services to go in on a joint project that might be funded through that Victim of Crime Act money in your state can be very important. And there are a number of APS programs that have, in the past year, begun to receive VOCA money to expand their services in a lot of different ways. So another way to reach out and find out what's happening in your state, and looking at different ways you can collaborate.
And so we really want to stress being proactive and finding out who in your community are the APS workers and who are the victim advocates. So do you have advocates that work with all victims, or do you have advocates that work only with older adults? It's also important to know where those services are housed. So is APS a standalone agency, or is it through a grant through your local area agency on aging? Are victim services set up in their own agency, or are they only through the district attorney's office? You might not think that matters, but you'd be surprised how often that really makes a difference in the lives of the victims that you're working with. They may have had a really bad experience with a particular police officer or attorney or someone, and so knowing that victim services is within the district attorney's office, they may feel really uncomfortable working with them. And so it really helps to have those answers in order to provide, to give information to the victims that you're working with. You also want to know, like Trudy was saying earlier, which types of abuse are reported under APS for your state laws. So like she was saying, APS is basically different in almost every state. And so for some states you can call to make a report about self-neglect, but in other ones you can't. So you really want to know which ones, which things you can call and make a report on and have them come out, and which ones you can't. And then also you want to know what services they're able to provide and which ones they can't provide, and which things victim services can do, and so that you're not walking all over each other. Because if I know that an APS worker has already looked into crime victims compensation with someone, I'm not going to make them go through that entire insane process all over again. And same thing with trying to get a home health aide. I'm not going to send them to another agency, like an outside agency, to try to do that if I know that you guys have already done that. So you really want to know basically anything that you can about the agencies that are in your community, where they're housed, where their grant funding came from, how to easily find those agencies, and to know who do they work directly with. So is there kind of one main agency that is responsible for overseeing everything, or are there multiple agencies and like this one does this particular thing and this one does this particular thing? And if you have a connection with those agencies and like someone that you can think of like, oh, this person needs this particular bill paid or help with this certain thing, and I can call like my friend over at this agency and have them set up this new program or implement something to help out my victim, it will make the process so much easier for everyone and so much easier for that victim. And so now I think we're going to do our last polling question.
Well, this is very encouraging to see the number of communities that have some specific services for older adults, and that's great because that is the kind of thing that we're looking for. Working together to begin to develop those protocols that you really need to work across systems and agencies that can better address older victims' needs, and on a regular basis working together to identify, are there gaps that exist? Are there needs that haven't had a service developed, or there is no service to respond to? So this is wonderful, and I encourage all our communities to begin to do a better job at that. Again, encourage you to get to know each other's systems and how they work, how they're different, and what are the different kinds of things they can provide for older victims. Create those opportunities to cross-train. Invite each other to serve on a local multidisciplinary team, on a coalition, form a task force on some special issue. Perhaps your community has been looking at development of an elder abuse fatality review team. And, looking into that. What are the things that are really needed for your community? Sometimes that means you'll need to develop a memorandum of understanding or an interagency agreement, particularly with confidentiality concerns. Maybe look at individual case management, as is very often done through FAST teams, financial abuse specialty teams, that are developed, made up of all types of professions to better address those cases. Whatever's needed to have a better approach to elder justice within your community. So those networks and coalitions begin to develop collaboratively and work together, whether it's for public awareness activities, which we've already mentioned, or whether it is some type of victim or elder justice related public policy development, ongoing funding, all of these types of issues. And the reason we should collaborate in closing our discussion and coming around to some questions at the end is we need to collaborate because in this current environment, all of our agencies have to focus on making operations as efficient and effective as possible so that we're not duplicating services with our very precious resources, but we are working collaboratively because there are increasing demands for services, there are shrinking resources, and there are great expectations within our communities about what should be there for all types of victims, including older victims. And strategic planning is really what we need to begin to do across our agencies and services to better meet all of those needs.
And so I want to let you know about Victim Connect, which is the helpline that I work on. And so it's our national helpline. We work with victims of all crimes across the United States, and especially elder abuse victims as well. And so you can contact us through phone, chat, and text, and it's 100% anonymous.
So, Trudy and Keeley, you ready for some questions?
Absolutely.
Okay, so we have a very good question here from Cedric Adams. Is NAPSA working on getting legislation passed so that policies are universal across the board when it comes to adult protective services?
Well, that looks like that question is right in my alley, Cedric, and you are reading our mind. We have been working on that for a very long time from NAPSA. We do have a public policy committee who works very hard. We have a national policy advisor and team who are every day that Congress is in session. We are there with the different committees that impact adult protective services work to begin to get that kind of legislation passed. There have been some steps that have happened with the Elder Justice Act, which helped bring about some funding that helps fund the Elder Justice Initiative Office, that helps fund the Administration on Community Living Office on Elder Justice and Adult Protective Services, which is within the Department of Health and Human Services, that are beginning to standardize APS work across jurisdictions and beginning to bring some grant funding in to help enhance and augment APS work. But absolutely, that's our goal, is to achieve that, and hopefully in the next few years we'll be able to do that.
Great. Thank you, Trudy. And there's also another question. Debbie Lang asks, I'm interested in hearing about how hospitals have collaborated with adult protective services and victim services for, I think that's emergency department patients for whom abuse report is made, or patients who are at risk for mistreatment.
Well, this is Trudy again, and I can speak from the Adult Protective Services perspective. As a matter of fact, we just had a webinar for our members on discharges from hospitals and emergency rooms for elder abuse victims, so that they could better understand what's involved in that discharging and making sure that when an older victim is discharged, that they are going with referrals for services, and that those referrals are made by the hospital on the behalf of the victim, as well as ensuring that APS is a part of the response. So many hospitals across the country have become more active in that, but it is an issue that we are continually working on, because the slightest physical crime can cause massive life-changing injuries for an older victim. So it's critical that we are constantly looking at that issue on behalf of victims, and we will continue to do so.
Great, thank you so much. I see another question from Shadana Brooks. What do you suggest for those advocates that work with victims at a national level, where they can find resources and requirements for every city and every state? And I would just throw in a shout out for the Elder Justice Initiative site, because we do have a lot of good national information on there and a resource map that you can search on. Any other suggestions?
Certainly the NAPSA website, that's www.napsa-now.org. Our research committee is very involved in research to practice, both for webinars that are regularly presented and research to practice briefs that come out of those webinars that are a constant resource for all kinds of services that are in place, for the kinds of best practice responses. So the NAPSA website is one place where some of those resources can be found.
That's great. We're getting a lot of questions now, and we're getting close to the end. So Here's another one from Cedric. How does NAPSA differentiate between domestic violence and elder abuse?
The definition of domestic violence is more family violence. When NAPSA looks at elder abuse, that's not to say that abuse in later life is sometimes an intimate partner. And I say intimate partner because folks need to realize intimacy doesn't stop with 60 or 65. So it might be a new relationship. It might be an abusive relationship that's grown old. It might be reverse abuse because the victim of the abuse for years and years is now the caregiver of the abuser. So there's lots of complicated factors that can come into play. And we look at it as a family violence issue. And we know if there is any type of abuse in a family, there is usually multiple victims within that family. So it is very much a issue for NAPSA, and we look at it from a family violence perspective. And I will say many of the family violence justice centers across the United States now have an APS worker in-house at the Family Justice Center.
Okay, great. And I guess we have time for one more. Dina asked, are there specific guidelines for working with victims with questionable capacity?
And I would say that that is definitely a time when APS and victim services need to work together. There are tools that have been tested and are used for capacity assessments, but for most professions, including APS and victim services, that definitive capacity question needs to be made by a professional in capacity assessments, particularly if that case is going into a court, either civil or criminal. So knowing what the tools are that have been validated and are currently in use, and again, Research to Practice on NAPSA's website covers many of those, but collaborating together to find out what are those issues in your jurisdiction in defining capacity and ensuring that victims receive that kind of assessment. And I will say that's one thing that VOCA is funding in certain jurisdictions, is making that type of capacity assessment more available for all older victims.
That's great. Well, I think that brings us to our conclusion today. I would like to thank both of you again for a wonderful presentation with so much good information. And as you could see, we had lots of questions today, and it was just great having you with us. We really appreciate it.
Thank you.
Thanks.
All right. Thank you, everybody, for your participation, and a special thank you to our presenters today. That concludes the webinar.